And now, it's a pleasure to introduce our Galien partners, Dr. Whitney Snyder, Vice President, Science and Technology at Alexandria, and Mr. Michael Ariel Katz, CEO and co-founder of the H1 Company, a leader in equitable and efficient drug development. The mind power on display tonight is a wonderful sight to behold.
Hi, everyone. I'm Ariel Katz, the CEO of H1, and congratulations to all the nominees and awardees tonight. Unbelievable what has been done over the past year to move forward science, progress, and medicine. By the way, I'm the last speaker before everyone has a drink in their hand and stomach in their food, so I'll make my remarks brief. Brief remarks, but hopefully powerful and lasting, which is why maybe they put me last. We all want to create a healthier future. And we're all creating science and medicine to do so. I believe that there are a few really important missions that we integrate into how we make this possible. The first one is medicine for all, not for the few. What is that? Thank you. What does that really mean? That means when we're creating drugs in drug discovery, clinical trials are representative of the patient population that has that condition. When we're thinking about access, it should not depend on how much money is in their wallet, the zip code they live, or the country they live in. And we need to make sure that that happens. And the third piece to it is we don't just focus on conditions that affect individuals in the Western Hemisphere. We need to remember that there are people that live all across the world, and it is up to us, nobody else, if not us, then who? Are going to create therapies to save their lives. People in South America, Africa, Eastern Europe, Australia, New Zealand, all across the world. It's in our hands, and to make sure we're making medicine for all and not just a few. The second piece is, I think we have the duty to educate society, healthcare professionals, patients about the power of science and medicine. It used to be that we can create an amazing therapy, go give it to our sales and commercial team, and people will start to use it and trust us. That's not the world we live in anymore, and I don't think that's the world we're going to be living in the future. I think it is going to be our duty to educate the world on science and medicine that can benefit them. And the third piece, which I think is the most important, and we all lived it over the past 2 or 3 years, is putting courage, morality, and truth before government, regulatory, and law. I'm not saying to break the law. But what I am saying is, if we wait for the law, it will be too late. Never in my lifetime, or in any history book I've ever read, did it say the government changed the law and then society realized the truth. If you look back 100 years, women's rights, they didn't wait for the government. 50 years, 60 years, civil rights movement. 3 years ago, when COVID hit, nobody in this room said, I wonder if the FDA is going to tell us to go and create a vaccine, or how much money we'll make. We all put courage, morality, and the truth and realized we needed to take the step forward as an industry and create the medicine to bring us here today and cure the world from COVID, which we were able to do. Without that courage, morality, and truth, we won't be able to realize representation in medicine for all, and realizing it is our duty to educate about the benefits of science and medicine. And in doing so, we will have a society that will trust our industry more. And eventually, everything that we want, profits, curing patients, and a healthier future will get there. I'm honored to be here tonight, and hopefully together we can create this healthier future. Thank you.
I've heard and learned a lot about medicine's innovation and the promise it holds for the millions who stand to benefit. I wrote a memoir about my own long, often lonely struggle to recover from stroke. The title I chose was The Beauty of Living Twice. Quite simply, I was lucky enough to get that rare second chance, a new start at life, My plea is that so many others, so many less fortunate, deserve that too. I just want to say, ultimately, it all comes down to access. Knock it off. Health for all is not just an opportunity. It should also be seen as a right. Great science is of no use unless the door to cures is opened wide. As Tony Fauci said earlier, all of us must commit. Can we do that? I hope it's part of our conversation at dinner tonight. I'd like to say, I am one of those people who likes to squeeze every last dollar out of everyone in every room I get into. So if you have a dollar to spare, I've lived all over the world. I've lived, in fact, at the very, very beginning of the AIDS crisis, I was living in Africa. And that is how I ended up working with Tony Fauci on Dindi for rare diseases, because we didn't know what AIDS was when I was in the hospital in Africa. And I was having a miscarriage, but there was no room for me to be cared for because there were all of these people just pouring into the hospital. Women, children, babies, men, women. No one knew what was wrong, and people were so sick. And I was in a cot in the hallway because there was no time to deal with my small problem. What's happened over these last, must be 40 years since then, as I've worked as a frontline AIDS activist and we've raised money around the world, is that I've squeezed every dime out of every room I've been in, because the one thing that I know is that it takes the partnership of individuals to help the medical community have the financial thrust that they need to find these vaccines and cures that we all depend on. We depend on you. So give up that pair of shoes you've been dreaming on, that dinner out you so casually go for, because the thing I learned lying in that hallway in Africa was that that doesn't really matter. So once again, thanks to our presenters, members of the Galien Awards Committee, distinguished guests, our humanitarian award recipient, Stanley Crook, and the many company recipients, these prestigious Golden Jubilee Awards, to the Galien Foundation, the staff, and the fine work it's doing to create the critical mass all we health givers need, a global community of innovators to improve the human condition. Thank you so much. Good night. See you at dinner.